Hey, everybody. Welcome to MedKids Provider Spotlight, where we are interviewing the most amazing private practices from all over the US. It is so much fun. I feel like I get to learn something new every single time. Everyone has a different perspective, a new idea, and today I'm sure they're going to have a lot to talk to us about. But today we have a really awesome two special guests. I love when we have two people on Provider Spotlight. We have Dr. Teri Roberts and Dr. Ryann Roberts with Arizona Orthopedic Physical Therapy. Yay, guys, I'm so
Hey,
excited. This is awesome. Thanks for coming on.
you bet.
This is great. I'm really excited to dive in. I know we have a little bit to talk about, so I'm going to go right for it. So, why don't you tell me about your story? What had inspired both of you to open up this amazing practice? You guys are like dominating in Arizona, like
I don't know about that, but
super cool. Yeah.
it
Tell
is
us
super
more. Tell
cool.
us more. Tell good.
Yeah, so we met in PT school it was at the time called Finch University, the Chicago Medical School. Now it's Rosalind Franklin University. And we were in PT school together and got our degree and got married all in the same time. And
Very
we were
easy.
in Chicago, and my parents were retiring, and they decided to move out to Arizona. And Ryan's family's from the West Coast also, so we decided to follow my parents out to Arizona. We actually caravanned out here, and then Ryann and I were both working at different facilities. And after about a year at each job, we decided that we didn't like the way that PT was done in Arizona. And we couldn't find places that we wanted to work. So we decided to open up our own clinic, and here we are.
Yeah.
That's amazing. How is it working? And you guys have a few locations. So why don't you tell me like a little bit where you're located and what are the most common areas that you might treat or you constantly find people are struggling with?
Okay, yeah. So we started our first clinic in Goodyear, Arizona, which is like 20 miles west of Phoenix. And we started with outpatient ortho. Ryann does adults, and I was in the school district doing pediatrics and realized that there just wasn't anything in the West Valley for private practice as far as PT, OT, and speech. So after a couple years, we decided to open up our pediatric portion. So we've had an outpatient ortho where we treat adults with all different orthopedic injuries. And then we opened up Kids Place, which is like a daughter of the AZOPT. So we do AZOPT and then AZOPT Kids Place, and we do PT, OT, and speech. So our first clinics were in Goodyear, and then now we have ortho clinics, so adults ortho clinics in Goodyear, Glendale, Buckeye, Gilbert, and Prescott. And we have Kids Place locations in Goodyear, Gilbert, Central Phoenix, and Prescott. And then we have aquatic therapy that does ortho and pediatrics at our Buckeye location.
Wow. Yeah. So I was right. You guys really are dominating in Arizona. So many things. And I love that you're working with kids and adults. What do you think that kids struggle the most with? And what do you think adults are struggling the most with kind of right now?
Well, I'll talk about peds and then I'll let Ryann talk about the adults. So in the pediatric population, we evaluate kids 0 to 8.
Mm.
Um, and so we really do a lot of neurological developmental issues. We have kids that are not meeting their milestones, gross motor, fine motor, or language milestones. And then we have kids like are the best kids with Down syndrome and cerebral palsy, autism. So we pediatrics is a very cool thing to treat. And people keep having kids. So there's always going to be need for pediatric therapy. And then the ortho.
So in ortho, exactly opposite, we do not do any of the neurological stuff. So they're mainly your pre-op, post-op, ACLs, total joints. Then like what everybody has is chronic low back pain, neck pain. basically all those kind of ailments. And then from there, we see probably young teenagers all the way up till very geriatric. So working with all those populations.
I love it. And I especially love that you serve the special needs community. It's near and dear to my heart. My best girlfriend has a twin that has Down syndrome, and he's
so funny.
Our lives. So
yes.
Very special. And I'm so glad that you especially serve that community. That is so awesome to hear. And what are some of the modalities that you use in your practice? Different modalities. You mentioned aquatic therapy and some other things. So I'd love to learn a little bit more.
Yeah, I mean, we are very much hands-on therapists. So I think one of the reasons why we opened up our own practice was because we wanted, as therapists, we went to school because we wanted to be able to evaluate, treat, and discharge patients, and not just evaluate and pass them on to assistants or techs. So I would say the biggest modality we use are our hands. And I know that both for our pediatric and our orthopedic settings, we do a lot of manual therapy, and then use modalities if needed to improve function, decrease pain. So in the pediatric world, I mean, we play with everything. So you should see our toy closet at all of our clinics. We look like a Toys R Us because you never know what a kid wants to play with. And we have to trick them into thinking that they're playing and not doing therapy. But we do have, we have the pool, which helps a lot with kids. And then we have, partial weight bearing equipment. So treadmills and we do e-stim, we do kinesiotaping. We have all the gadgets, but most important things is we use our hands. And then for ortho, I think pretty much the same thing.
Ortho is the same thing. We don't do a lot of electrical stim. We don't do a lot of like ultrasound, things like that. But, so I guess our modalities there are dumbbells, kettlebells. Again, our hands, we do dry needling. We'll do some kinesiotaping, do cupping, BFR, things like that as needed. But again, the biggest thing is being functional, getting them back to something and then using your hands and giving them something that they can't get at home. Like you can't just Google, how to work out a muscle or something like that. So.
Yeah, you mentioned something really great, Dr. Google, which brings me to my next question, which I love to ask pretty much at every spotlight. There's a lot of misconceptions, and I'm sure things float around. People come in and said, Dr. Google told me that, this, and that, or ChatGPT said this, and that. What would you say are some of the biggest misconceptions about, what you do, or maybe talk about how your approach is very different than maybe other practices out there?
Yeah, I'll start again with peds. So, Google's great to get some basic information.
Yeah.
But every person, every individual is different. And so it is impossible for Google to be able to assess each individual child, each individual home environment, each individual parenting style. And if Google worked, we probably wouldn't be in business, because you can look at Google, but if you don't know how to get the information and how to relate it to what the child's actually doing, the child's not going to get better. And so, yes, Google's great, but it doesn't, Google doesn't actually work with the kids that we see. So the parent is much better off coming in to get at least a consult to see what can be done. I think for the misconception for my pediatric therapist is that it really does look like we're just playing. We're not just playing. Like, we have the science behind everything that we're doing. And our kids do make huge functional progress, and there's a reason for that, because we have a reason behind our play. So I think that's probably, like, even when you have a high school kid that comes to volunteer and do hours, and they're like, oh my gosh, this looks like so much fun, you just play with the kids all day. It isn't actually true. We have a method to our play.
Yeah.
So I think that would be the biggest misconception for pediatric therapy, that, we really, if we feel that the parent could do it at home through home exercise program, we're not going to keep seeing them in the clinic. Like, that's the ultimate goal, is to educate the parent to be able to have the kid make progress at home. We don't want lifelong therapy. We want therapy for a purpose, and then send them on their way so they can go do soccer or swim or eat at a restaurant.
Sure.
So,
No,
yeah.
I love that. That's really, I think that's really important to talk about. I'm sure that, people have perception, especially when they go in, they see things. It looks like something else, but there's so much behind, you know, what's happening, that you're doing while you're doing something for a very big purpose. And so, yeah, that's a really important thing to call out. I love that.
Absolutely.
And then my mind keeps jumping around, but I would say my misconception on the adult and ortho side is that physical therapy isn't just for like athletes or somebody that had a surgery or an accident. Physical therapy can help a multitude of people for just from just your normal aging process. I think part of one of my statements are that people think that as you get older, you should hurt and you just have to live through it and work through it and stuff like that. And you don't, right? We can work with all that. We can help those, restricted joints or, tightened muscles or weaknesses and all that and increase your balance, all those things to make you more functional with less pain as you age, rather than waiting for something to actually occur and then you have to try to fix it. So I think that's probably the biggest misconception probably for physical therapy, and or that physical therapists can do manipulations. Physical therapists can do a lot of things that maybe other professions also can do, that people automatically think of, like if they had an accident, where should they go? If you were like in a motor vehicle accident, right? We can do all of that as well.
And that's a really important piece of what you just said. Do you think that people would be able to maybe prevent certain injuries if they were regular doing physical therapy? Yeah, I'm seeing lots of nods. Okay, yeah,
for sure. And I think, I don't know how long ago it was. It probably hasn't changed a lot, right? But we think that approximately 10% of people who would benefit from physical therapy actually seek physical therapy. So there is like a huge world of people out there that would benefit if they would just come. So
yeah. Pain's not normal, right? So like we should, if we're feeling some hip pain, we're all aging in this direction, right? So like if we could work on maybe our balance or work on, some of that joint pain, that's gonna happen, maybe not gonna happen, but just being more agile, I think that would help all of us.
Well, and I think about like the high school athlete or even preteen athlete. 20 years ago, you did not, maybe 30 years ago, it wasn't normal to do a sport year round.
Yeah.
Like so you have these kids that starting at 8, 9, 10, 11 that are doing one sport 12 months out of the year for years on end. And there's no way to not have them they're going to get injured if they're not doing something to offset all of the same repetitive movement that they do within a sport. Whereas when we were growing up 30 years ago, it was, you did a sport for 3 months and then you did another sport for the next 3 months and another sport. So you were constantly using your body in different ways.
Yeah.
Whereas a baseball player that throws for 12 months out of the year, and unless you do something to prevent the injury, you're going to get injured. And PT can be a big part of that too.
Yeah, no, I love how you, of course, serving other people, but athletes too, they're doing this all the time. And, what if it's preventing an injury, but also helping them perform better,
Right.
I feel like that isn't talked about, and you could really be helping them perform better. They could be getting up to that next notch of like, oh, maybe I'm doing some arm exercises, whatever, I'm a pitcher, and now I'm throwing the ball like 10 miles per hour faster than I was before because like I have great arm conditioning. Like that could be really helpful to someone.
Yeah. I
love it. Wealth of knowledge. Now, kind of shifting totally different gears, but something I definitely wanted to bring up today. I know that you have a nonprofit, and and I really would love to talk about that. Tell us all about it, the ins and outs, and the things that you do to help people in your community.
Yeah, absolutely. So the nonprofit is not necessarily part of it. Just we one, we love our therapists. Like when we hire people, we are not hiring them to be therapists. We're bringing them on to be part of our family. And so we are very small business oriented, family oriented. You know, we want to have a high quality of work, place to work. And that was one of the reasons why we opened it, is because we wanted to enjoy going to work every day. And we were not at our current places. So we try to create an environment that people want to come to work and that feel valued, and can, if they feel valued, then they're going to be able to give high quality of care to the patients that they're seeing. So we had one of our therapists, her name is Mariah, and she found when she got married, was pregnant, and found out that when she was about 37 weeks pregnant that she had cancer. And so they delivered Clara at 38 weeks, and she is perfect, beautiful, wonderful little girl. But unfortunately, Mariah passed away when Clara was 2 months old, and which was March 23rd of 2020. So we were in the craziness of COVID at the time also. And so we decided that we needed to do something to continue her legacy on, and we created Mariah's Miracle, a foundation that provides therapy services or like durable medical equipment to children that their insurance denies it. So we've, over the last 3 years, so it took about a year to get the nonprofit status and get everything up and running. But over the last 3 years, we've raised almost $240,000, and we've been able to provide lots of children equipment. We've done down payments to 3 wheelchair accessible vans. We've done probably 20 of those helmets for the little ones that you see in the community. We've done a sleep safe bed, adaptive bicycles, adaptive strollers, orthotics, therapy services. So one of Mariah's pet peeves was when she was writing letters of medical necessity for a child that needs something, and then insurance gives the big fat denial on the letter. And she would always be like, I don't understand, like this kid needs it. I wish there was a way that we could just give it to him. So we created the ability to just give it to them. So we just provide this benefit to Arizona children under the age of 18, and they can just fill out a grant if they have an insurance denial, or if we know that insurance, there's some insurances we know right off the bat that aren't going to approve the equipment. So we don't actually need the denial for that, because we're already pretty versed in what insurance will say yes or no to. So yes, that's kind of, so it's not completely associated with AZOPT, but it is something very special to us, and it allows our therapists to do a really good community service by going to all of the events and raising money for Mariah's Miracle.
I love that. It's such a great tribute to Mariah, and
yes,
that would also be my biggest pet peeve as well. So
it's a big one.
Really big one. It's a really touching story. I'm gonna not try to lose it on the provider spotlight, but it's really nice to see that you're doing that for the youngins in your community that really need it. So
absolutely,
that's fabulous. Awesome. Well, before we wrap up today, I would love for you to tell people how they can reach out to you. Any questions that they might have, or anything in regards to Mariah's Miracle. Would love for you guys to talk about how people can touch base.
Absolutely. So I think our website's the best way. It's www.azopt.net. And we keep our website very up to date. So they can go to that and click on the info and write us. That would be wonderful. But it is very up to date. So all of our therapists are on there, and all of the new things that are going on. And then for social, it's at AZOPT Therapy is our handles for all of them. And then for Mariah's Miracle, it's mariahsmiracle.org is the website to that. But from our website, you can also get to Mariah's Miracle's website.
Awesome. We so appreciate it. We so appreciate what you're doing for your community. This is what makes the world go round. This is exactly why
Absolutely.
we do this here, Provider Spotlight, interviewing private practices, tell their story, to get things out, to help one another and put out good news stories. And I'm tired of bad news. So I love this. I love that we get to learn every week with new people, and appreciate your time.
Absolutely.
Yes,
Thank
thank
you
you.
so much.
Thanks so much.
Take care.